Assalamualaikum warahmatullahi wabarakatuh, everyone. Um, so this is lecture that I'm going to explain and discuss with you guys about obesity and diabetes and how the role of exercise can make a better improve in their living. So first of all, let us look into the etiology of obesity and diabetes. So basically, etiology is the study of reason and cause of certain things that happens. So for obesity, it is because of the excessive accumulation of adipose tissue. So it is a condition involved an excessive accumulation of body fat that is, treating the health condition. And it is also defined using a body mass index, although to some people or experts, BMI might not be as accurate indicator to determine level of obesity, but it can be used as well. Apart from BMI, we can also use hip and waist circumference to classify whether the person is actually can be categorized as obesity. And then if you're using the BMI as indicator, usually if you achieve more than 30 kilogram per meter square, it can be categorized as obesity, while more than 25 kilogram per meter square is overweight. So usually it is generally accepted that obesity is caused by imbalance between energy intake and energy expenditure. Therefore, in general, energy intake is higher than energy expenditure that can lead to, somebody to put on some weights. Put simply, obesity is due to too much food intake or hyperphagia. That's the hyperphagia. It's the scientific terms of overeating. So yeah. And also, when you're experiencing or practicing hyperphagia for a chronic phase, in a chronic phase, a long period of time, alteration in the body by lowering the secretion of leptin could happen, where leptin is a hormone that can be classified as the anorexigenic hormones or appetite suppressing hormone that stops you eating. So it can be reduced because of the hyperphagia condition in the chronic phase. However, it can be also due to a genetic factor apart from behavioral factor. Somebody could get obesity because of its heredity. However, we cannot discount the main factor of hyperphagia itself, the positive energy balance that leads to obesity. Okay, so yeah, for those who have have a hyperphagia, they have lack in their secretion of anorexigenic kind of a hormone, which is satiety hormone or hunger suppression hormones, and they have high level of orexigenic hormones or hunger, hormones that make them hunger. So therefore, they will end up having, more energy intake than energy expenditure if, their daily, they have a lack in exercise, physical activity in their daily routine. So this is some hormones that involve in appetite regulation. Leptin, okay. Leptin is the appetite suppression, meaning that will stop from you to eat. It's secreted by hypothalamus, and then PYY is also a type of anoxygenic hormones. It is PYY is, will release when your stomach is stretched. Okay, PYY will release to stop from someone's to further eating. So for those who have certain clinical condition, their PYY didn't secrete, although their stomach is already stretched quite huge. So yeah, so they keep on continue eating, end up having excessive energy intake or a calorie intake in their body, and then leads to obesity. Then CKK as well is a satiety signal. Okay, satiety signal. So it is secreted in the small intestine. And then ghrelin is the hunger hormone, that trigger for you to eat when you feel hunger. So ghrelin is the one that plays an important role. And then GLP-1 as well is anoxygenic hormones, and the same goes with oxytocin. Okay, they opposite acts of the ghrelin, meaning that also anoxygenic hormone. So these are the hormones that can alter or regulate your food intake. So for those who have condition, okay, these are the example of a boy have condition of hyperphagia or low level of anoxygenic hormones. So in this condition, a clinician usually will give a leptin therapy. Okay, this is after the leptin therapy to reduce food intake by ingesting the boy with synthetic leptin hormone. So yeah, this is the difference in obese person. This is like a very severe case that the patient needs to be jabbed with leptin. Okay, yeah. So that is obesity. And then let's go to diabetes. The diabetes mellitus is the metabolic disorder due to low insulin that leads to hyperglycemia. So usually for those who have diagnosed with or have diabetes mellitus, they will experience infrequent urination, excessive thirst. This is because of the glucose, exit from the body cell. It makes this, response happen to their body. So there is, apart from diabetes mellitus, there is also other types of diabetes, which is a very rare case, which what we call is diabetes insipidus. But apart from glucose, diabetes insipidus is actually due to the low secretion of vasopressin, okay, meaning that it leads to dehydration, the body having a dehydration or unable to handle or control its hydration status because of low secretion of vasopressin. So vasopressin is another name of a diuretic hormone, and I think it is, I would say, better, and I like this better. I like the name itself better than antidiuretic, because, you know, by looking at the name, vaso means vessels, pressin means suppress, so it's kind of you know, because we know that urine is once a blood that been pressed to get rid of water in our kidney. So vasopressin is, you know, in a way giving the idea of the function of that hormone itself, pressing water in the blood vessels, which is vessel, to get rid of excessive water to the kidney. So vasopressin is the name of hormone that I personally prefer compared to antidiuretic, because it's just resemble the function of the hormone itself. So yeah, but that is, I would say, really rare case, and only consists of 2% in the whole world population. But diabetes mellitus is something that we should worry about. It's you know, the prevalence of the diabetes in the globe is, I would say, worrying, especially diabetes type 2, the one that we don't inherit it. Sorry, the one that we, you know, due to, you know, lifestyle rather than you born for it. I know there's, you know, there's some evidence that shows diabetes mellitus can be due to genetic, but, you know, most of the findings out there reported that actually type 2 diabetes is due to behavior, okay, behavior of the person, because although if the person have history or family history of diabetes mellitus, if the person can, you know, control the prevalence, meaning that the person's practice an active lifestyle as minimum as it is, which I'm going to explain that later. Of course, it can reduce the risk factor of having a diabetes mellitus compared to person who have history, family history, but did not do anything. Of course, he or she will end up having, you know, a premature death due to diabetes mellitus type 2. So for that, I'm going to take just to explain you briefly about the two types of diabetes mellitus, which I have already explained you earlier. The type 1 and type 2. Type 1 is a juvenile due to the autoimmune low insulin secretion, whilst type 2 is due to insulin resistant or low insulin production from the beta cells at the pancreas. The type 1 is because of the pancreas itself, you know, doesn't produce enough insulin from you know, even from childhood. It bonds like that. Okay. Well, type 2 is because this lifestyle and you know, for chronic period of time that leads to inefficiency of the insulins to absorb glucose to the tissue. So now let's now discuss about, or look into how physical activity can manage both obesity and diabetes. So yeah, there's a lot of evidence out there that has been reported the effectiveness, or the good part of performing physical activity in both preventing and also managing obesity and diabetes. In fact, not just preventing, it also can manage or act as the alternative medication for you to treat your obesity and diabetes. So yeah. So not all obese individuals have time and supports required to perform large volume exercise. So yeah, for those who have obesity, have a certain degree of obesity, of course, they can't really afford to perform a high volume of exercise, and most obese individuals do not have sufficient motivation as well to maintain physical activity for a long period of time. So exercise trainer should alert on that, put that in mind in helping them out. You have to motivate them, keep them, find ways how to keep them engaged with to sustain their physical activity involvement, right? In order to improve their well-being and manage their obesity self. So apart from exercise, physical activity, you have also need to remember that if you remember when I mentioned to you, the prevalence of obesity is because of the positive energy balance, meaning that energy intake or caloric surplus happens. Energy intake is higher than energy expenditure. Therefore, in managing or to improve their obesity level or reduce their body weight, you have to also combine your training program with negative energy balanced diet, okay, to see a better result. So yeah, you must need to understand how to prescribe or design a diet, and you must also know how to do a calorie counting. Okay, it's not difficult. I believe you have learned this in one of the courses, okay, probably sports nutrition courses. So yeah, you can apply that together with the training program. And please do remember, don't prescribe exercise that could that is high risk to them. Just focus on low to moderate intensity rather than high volume, because most person who have obesity, as I mentioned in my first 2 points, having a difficulty to sustain their motivation because they just trying to get use of the new daily routine, exercise routine, or dietary regimen. So you have to give them some times to adapt with that new way of doing exercise and form a diet. And also there's also the genetic factor, as I mentioned earlier, that could influence the fat loss variation. Some people can easily get rid of fat quickly, some people, have need to sometimes to see some progress, but just don't generalize your patient or your trainee. Don't generalize them. If you have, make it individual based on their condition, and don't compare, of course, from your one patient to another patient. And yeah, because it will end up for them to demotivate themselves if you compare them with other person. Sometimes they just compare with their other colleagues. Okay, if they are work in the team, suddenly they realize that the other contender improved better. So you must play your role in explaining to them. It's rather, a genetic factor. The way they, for example, their leptin secretes better, because leptins can end up, to promote more lipolysis. For those who didn't secrete leptin, at certain degree, could, slower the process of lipolysis. So yeah, and the role exercise in managing obesity in children is something that is still need more investigation. But generally, you have to insert the element of fun and enjoyable, rather than explaining to them the scientific behind it. So you have to explain to the child itself or children that have obesity, what you can gain, or what is the fun thing if you do physical activity, to make sure they, have interest to do more exercise or physical activity in improving their obesity. So that is a role of physical activity in managing obesity. And then let's go to diabetes. Of course, same like obesity, physical activity and fitness have a strong important role for type 2 diabetes as well. And it is also evident for type 1, the one that you born, the patient born with low ability in secreting insulin. Okay, but the evidence is limited. Okay, because for those with type 2, there's still there's still a physical activity role that can make or reduce or to improve the degree of insulin sensitivity, hence improve glucose absorption to the muscles tissue or other tissue in the body. But for type 1, since they're already born with low level of insulin, so there's a evidence of how physical activity can improve their condition. But yeah, the evidence is still pertinent for type 1 diabetes. Also, when you considering or prescribing physical activity or exercise for diabetic population or patient, you must protect them from all the comorbidities that associate with blood glucose elevation or blood glucose depletion. So I'm going to discuss this comorbidities in my later slides. And also, low cardiorespiratory fitness can be also associated with high risk of death among diabetic patients. So for those who are diagnosed with diabetic, if the prevalence of cardiovascular risk factor, it's increased as well. So you must take that in mind. That could be the comorbidities for this population to have as well. So when you receive this kind of patient, you must already put this into account, all the cardiovascular risk factor, for example, such as prevalence of stroke, and then high blood pressure, and also atherosclerosis could also come together. Okay. So this is the evidence study by Hu et al. 2001 shows that it shows that a prospective cohort study involving a woman who shows that recruits around 5,000 female nurses with type 2 diabetes. So result from this study shows that physical activity was assessed via questionnaire on 5 occasions over 14 years period of time, and the duration of moderate to vigorous physical activity performed each week was inversely related to the risk of cardiovascular heart disease. So this is evidence the role of exercise that actually can reduce the risk factor of among diabetic people. So it also shows the relationship between diabetes and also premature death due to the cardiovascular disease. So this relationship is significant throughout the category of metabolic equivalent. Okay, this is the metabolic equivalent. If you remember how to compute the metabolic equivalent, which literally, oxygen consumption, you have to divide the oxygen consumption with the resting oxygen consumption. Okay, so literally the amount of oxygen consumption you perform on that particular week will be divided into the resting oxygen consumption, 3.5. So this is in unit of METs. So women who reported no vigorous exercise, which is no exercise, which is about 6 METs. Okay. 6 METs. Less than 1 MET will have higher prevalence of having cardiovascular heart disease, whilst for those who women who perform 7 METs in a week, okay, per hour in a week, will lower the risk factor of having cardiovascular heart disease. So yeah, this is some evidence that you can get the idea of how performing physical activity among diabetic population can reduce the risk factor of having premature death due to cardiovascular heart disease. So for diabetic population, you have to remember when you have a patient, The main goal is to maintain normal blood glucose, okay, normal resting blood glucose to your patient. In fact, if they are performing exercise, they still have a prevalence or tendency to experience hypoglycemia, or in fact hyperglycemia itself, because they have a difficulty in maintaining blood glucose. You must take that into consideration as well when you're doing it. So make sure they have, prepare their insulin jet, and also you must prepare them with, foods that can, help them out with increasing the blood glucose if they are hypoglycemic. So when they do exercise, make sure they have these two in hand. Okay? And apart from that, since I mentioned the type 2 diabetes is very much associated with the prevalence of cardiovascular heart disease, and cardiovascular heart disease risk factor is the lipid profile itself, high density lipoprotein, low density lipoprotein, and total cholesterol. Could be also blood markers that you need to monitor as well to make them improve. Okay, so for those who have diabetes, they might having a higher total cholesterol, particularly low density lipoprotein. So the aim is for you to reduce by turning the LDL into HDL, and you can achieve so by performing a regular exercise. Okay, there's many evidence out there have shown that even performing a short duration but high intensity, if you perform it in regular manner, can improve your HDL level. Okay, and of course, a prolonged type of exercise can also improve your HDL level. There's many out there. As long as you perform it in a regular basis, you will see an improvement in the patient lipid profile. So, and exercise can also have been shown to be effective in improving your blood glucose absorption to muscle cells or other cells in the body by reducing the glycosylated hemoglobin, or simply said as the HbA1c. So HbA1c is the marker in the hemoglobin that associated with diabetes. So usually the type of exercise that you can use to your patient or prescribe to your patient is aerobic. For example, cycling and brisk walking. Okay, because usually cycling and brisk walking is a type of aerobic exercise that people or your patient can sustain longer. Okay, they can work in a group, or you can put an element of fun and enjoyable in your training program by asking them to listen to music, for example, during cycling or brisk walking. Or in fact, you can do the exercise together with your clients, and do it within the low to moderate intensity at the first beginning weeks of your new training programs. This is to allow fat to be mobilized, therefore improve their lipid profile. Okay. And if it's high intensity, if only they have adapt to certain degree of intensity, okay, they have used to it maybe on week 4, 5, 6 and above. Okay, you can include an element of high intensity to your diabetic patient or diabetic client, uh, uh, and do it in the intermittent manner, meaning that alternative of low intensity, alternate it with high intensity and then low intensity, high intensity. Do it in intermittent manner, because at the end you have to train your diabetic patient to adapt with high intensity type of exercise for their heart to being trained under stress or higher stressor, because most diabetic patient having a difficulty in adapting with high intensity exercise, meaning that their heart couldn't pump faster due to that is one of the comorbidities among diabetic population. So you have to sometimes when they have adapt to it, you have to train them intermittently between low, moderate intensity, also high intensity, just to get their body adapt with the higher demand of exercise, but not too long. Just like between 2 to 5 minutes interval after 30 to 60 minutes 30 to 60 minutes of low or moderate level or intensity of exercise. Apart from aerobic exercise, there's also evidence shows strength training or gym training can increase insulin uptake. Okay, insulin sensitivity to skeletal muscles, and also any type of physical activity can improve beta cells function to secrete more insulin. And then as I mentioned, exercise itself is actually a good medicine that will give you a multiple effect at one time. Okay, unlike any medical medication or pills that can only affect on one or two things. Okay, exercise can give you multiple effect or multiple benefit. For this case, it will improve the beta cells function and also increase the insulin sensitivity, and also improve the HDL at the same time by reducing the level of low density lipoprotein or LDL. So it will give you multiple effects. So these are the things that you can explain to your patient and make them know. Usually doing exercise, you gain many benefits. So these are the prescription of exercise for prevention and management among obesity and also diabetic population. We're going to discuss that in these slides. Excuse me. So for obesity, trainers should understand the individual difference. This, as I mentioned, not everybody will progress the same. And then you have to explain to your clients so to avoid them to become demotivated because of having a slow progress. Everybody is the same. Everybody is not the same. Sorry. And then and apart from training, you should also put dietary intervention as dietary negative energy balance as the other factor in improving the obesity rate. Okay, and studies have shown that a combination for both exercise and diet control can leave 20% greater weight loss than a diet alone compared to diet alone. So make sure you use the energy together with the negative energy balance or reduced energy intake. Of course, they still need to have a certain calorie before they do exercise, but you have to explain to them apart from exercise diet is also important, and not just that, timing. Okay, when they consume the food is also crucial. Okay, you must also understand you must also understand when to consume more food and when to consume less food based on your body clock or body circadian rhythm. So you must understand that. So basically, if you have heard the inverted pyramid, during the day usually you eat more, and towards the night you eat lesser. So you can apply that to your clients and make sure they have sufficient energy before they perform exercise, or else you have to remember, without any sufficient energy, they won't have a motivation to continue doing exercise, and they won't be able to perform good. Okay, so pre-exercise is important as well for both obesity and diabetic people. So researchers has also reported that the estimate minimum energy balance that you need to control to prevent weight gain is actually 100 kilocalorie per day. So plus minus 100 kilocalorie should not exceed than that, okay, to prevent any weight gain. Okay, based on daily, for example, if you monitor your calorie count, okay, if you monitor your calorie count, and usually you will eat around 2,500 kilocalorie. Okay, make sure on the following day you do not increase your calorie intake by 100. Okay, because if you exceed then 100 kilocalorie, okay, you will notice that actually you will gain more weight. So make sure if you want to sustain on that particular weight, you must make sure it will just stagnant or consistent 2,500 kilocalorie per day throughout. So it will be balanced that way throughout your life, for example. So yeah, that is energy balance. Estimate energy balance. If you eat more than that, you add the calorie of 100 kilocalorie in your diet. On the next day, ahead, for at least 1 or 2 weeks, you add 100 kilocalorie in your diet, meaning that you will eat 2,600 for a certain period of time. You will notice that you will gain weight. See, so 100 kilocalorie is the threshold for you to realize that if you add at least 100 or more, you will add more weight. So yeah. So apart from that, approximately at least 15 minutes of walking per day is required for you to maintain your weight as well. Okay, make sure you walk at least 15 minutes. This is this is addition. This is not in your existing activity. This is additional to your existing activity. You must walk 15 minutes every day in order for you to maintain on that particular weight. So if you notice both points, okay, touches about energy intake and also energy expenditure. So in order for you to maintain that particular weight, you must not exceed 100 kilocalorie. So the threshold is 100. Make sure one day to another day doesn't exceed 100. And then you have to walk about, approximately 15 minutes every day to sustain the energy expenditure, and then you can maintain that particular weight. So this is the minimum, the minimum energy intake and energy expenditure that you have to control in order to maintain that particular weight. This is research has been reported from the research has been reported. So for weight loss, it is recommended for you to do more, of course, and by performing 150 minutes per week or approximately 20 minutes per day, you will of course see improvement in your weight loss. Okay, improvement in your weight, meaning that you will lose weight. This is the guidelines from the US Department of Health and Human Service in year 1996. And you have to perform it in most days of the week. Okay, most days of the week, meaning that more than 4 days, 4 days or more. And then apart from that, UK Department of Health also suggested that 45 to 60 minutes of moderate intensity per day is good to prevent obesity. So if you sustain every day, you do moderate physical activity, okay, for 45 to 60 minutes, your BMI wouldn't reach 30 kilogram per meter square. BMI of 30. Okay, so you can prevent obesity by performing 45 to 60 minutes of moderate intensity. Yeah. So this is just for you to, if you couldn't, say, get any device to monitor your calorie burn, this is the equation. Usually 200 to 300 minutes per week of moderate intensity will burn approximately more 2,000 kilocalorie. So yeah. So yeah. So for as I mentioned, aerobic type of exercise is the best option because it's prolonged and it's promote lipolysis to burn more fat, and then when you burn more fat, you will also burn. You also reduce in weight because it utilize the energy storage in your body. So yeah, that's why aerobic type of exercise is the best option. And these are the prescription that how you can burn excessive fats. This is, you have to keep in mind, this is the minimum for you to prevent and minimum for you to observe your weight loss. So if you prescribe to your patient, make sure you at least achieve this on the first few weeks before you can increase the intensity or timing or distance in order for you to observe more progress to your clients. So you have to remember this is the minimum prescription that you can maintain or slightly see changes in your client's body fat percentage or body weight. Okay, and then you have to add more on the subsequent weeks. So for diabetes, so how much physical activity to prevent obesity? Oh, sorry, yeah. Diabetes. Okay, how much physical activity to prevent diabetes? So it's literally the same like obesity. You can read back the points in the diabetes. So in the obesity, and you use it for diabetes population. So these doses of exercise that I mentioned earlier, okay, has been shown to improve insulin sensitivity. And as I mentioned previously, it is recommendable to do interval exercise of 5 to 10 minutes of strenuous in 30 to 60 minutes of mild exercise, meaning that between low to moderate intensity exercise, you have to include high intensity exercise because you have to train them to adapt with high intensity demand. Okay, stress their cardiovascular system up a bit because if everybody know, diabetic people have a very low tolerance in high kind of intensity exercise, meaning that their heart rate difficult to adapt with certain degree of high demand type of exercise. But you have to train them by including a strenuous exercise intervally in the in the mild type of exercise, okay, within the mild type of exercise. Okay, and also you must do it in 3 non-consecutive days to allow for them to rest, of course, to motivate them more, so for them to replenish energy, and their cardiovascular system can adapt with, can rest a bit because, as I mentioned, they have difficulty in compensating with the exercise demand, so you have to allow a rest in between at least. So no, please don't do 3 consecutive days of training. Make sure 2, and then rest a day, and then continue on the following day. And walking is the most favorite type of exercise, but you have to, the complication is because diabetes people usually obese. It require weight bearing. Walking, it require weight bearing. So other option, if they can't, the comorbidities is arthritis. If, for example, you can choose other option like cycling and swimming, okay, or other non-weight bearing type of exercise, okay, non-weight bearing type of aerobic exercise to your diabetic patient or client to prescribe this kind of training program to them. So so apart from that, high level of leisure time of physical activity has been shown to improve glycemic control for type 1 diabetes, meaning that when you do exercise training program to your type 1 diabetes patient, okay, make sure you have high leisure time, meaning that for their body to adapt with the exercise demand. Make sure that you have a more rest in between, or interval of rest between the physical activity, because it has been shown to improve the glycemic control, meaning that their blood glucose level will be maintained, not too high or not too low, meaning that the patient will not experience hyper or hypoglycemic condition. So make sure you have high level of leisure time during the physical activity for type 1 diabetes. Okay, because in considering their condition, which have a low level of insulin secreted in their body, you have to consider more leisure time to them. And before performing exercise, you must remember, you must do trial and error at the beginning, okay, of your exercise, just to adjust them with the dose of insulin of your client to prevent hypo and hypoglycemia. So, as I mentioned, you have to prepare them with, food like, bread, or quick food like bread, or something that is contain high glucose, and also together with their insulin dose, and monitor their, if you can afford in monitoring their glucose level, you can buy a glucose meter and glucose strip, and monitor them in the first few days or few weeks of your initial training program, and try to understand their condition, actually what kind of type of exercise that they can tolerate, and what is the dosage of insulin that they need to take, okay, before they perform the exercise. You have to understand that first before you go to overload your clients. Okay, you have to understand that, and then of course you can plot that in the graph. At a certain degree of intensity, how is your client's tolerance level in proceeding that exercise? You can draw systematically the glucose tolerance based on the exercise intensity and exercise demand. Okay, and that can be work as well. You must do trial and error. Okay, because you will never understand how they will respond to a certain degree of exercise when you implement an overload in the training program. Excuse me. So these are the comorbidities or side illness of both obesity and diabetes. So obesity is like type 2 diabetes, which will also have a few package come together, which are the cardiovascular heart disease. Okay. Usually obesity people will have cardiovascular heart disease because obesity is excessive in lipid, and excessive in lipids, of course, leads to potential of having cardiovascular heart disease. And then cardiovascular heart disease is linked to hypertension. Okay, clot of cholesterol within the artery wall will increase the pressure, and that is hypertension. And hypertension, of course, could lead to stroke. That's also the comorbidities of obesity, and several other forms of cancer, and also arthritis, because they are heavy body weight, could lead to them having a problem in their knee joints, ankle joints, that sort of arthritis. So you have to keep in mind when you prescribe exercise to this population, these are the comorbidities. And of course, it's depending on the severity of obesity of your patient. And for diabetes, you have to know that studies have shown life expectancy can be reduced to 5 to 10 years for that type 2 diabetes. Okay, and then the main cause of type 2 diabetes is due to coronary heart disease, okay, and also stroke. And for diabetes population, their microvascular and macrovascular capillaries and large vessels can also be affected. So you have to take that in mind as well. Apart from all the cardiovascular, heart diseases, and stroke, they have problem with their blood system and neural system as well. Okay, other problem is hypertension, kidney problems, nerve, and eye. So these are the problems that they might experience. So, and you have also need to ask them of any medication that they take together and make them, consume all the medication that is required before they perform exercise activity to avoid any risk of injuries. So other complication of type 2 diabetes is acute glycemic reaction during exercise. Of course, this is the same explanation that I gave above before. So you have to prepare any complication of having hyperglycemia or hypoglycemia. Okay, because they can't really tolerate with in sustaining their glucose level. So make sure you prepare food and also dose of insulin together when they perform exercise in case they experience hyper or hypoglycemia. Okay, and that's everything for this part. Thank you very much. So I'm going to include this lecture slide in the spectrum. Okay, when you have complete watching it, okay, I'm going to include it in by next week. Okay, after everybody have watched and answer questions that I've included in the H5P. Okay, thank you so much, everyone.